Well, good afternoon, good morning, depending on where you are. Welcome to Allergy Insider. I'm Tara Bruner, and we're going to talk today, and I'm going to add my good friend Derek, Dr. Derek. So give me just a moment to get him invited to this particular opportunity today. So we're going to talk about colds and viruses. I often say, 'tis the season. There's pollen everywhere, so we want to just ask the insider inside inflammation of respiratory illnesses with allergy and viruses. And there we go. Dr. Varner, Dr. Derek, it's good to see you.
Hey Tara, good day to you. How you
Yeah,
doing?
I'm doing well. How about yourself?
Hey, I'm doing well on this Friday. I'm doing
Yeah, it's a beautiful day. So today our conversation is really about allergies and viruses. So again, I want to welcome everybody. Just a quick introduction. My name's Tara Bruner, and I am a practicing physician assistant. And I practice in primary care, but I also have another gig, which is I'm a clinical educator with Thermo Fisher Scientific. And this particular organization, Immunodiagnostic, our division creates or has an instrument that makes blood allergy testing and autoimmune testing. So really that's our conversation today is really around allergies. And I want to welcome my good friend, Dr. Varner. So I'll let you introduce yourself, Derek.
all right. Thanks, Tara. I would just like to say good day, everyone. My name is Derek Varner, and I would just like to share with you after serving nearly 30 years in the United States Air Force. I currently reside in San Antonio, Texas, and I continue to practice as a hospitalist here. Also, one of Tara's colleagues as a clinical educator with Thermo Fisher for the last 8 years. So I'm just glad to be here on today's.
Right, absolutely. So this is the season to talk about allergies.
We,
I mean, we're starting to see the pollen all over the cars, the yellow, gross. You just know that it's all being inhaled. So let's try to figure this out today. So I just want to ask you, what is going on with allergies and colds right now? Just what season are we in right now?
oh my goodness. Great question. I would tell you that sounds like me right about now, Tara, with the
Yeah,
rest of 25 million people in the United States who is experiencing this upper respiratory
yeah,
symptoms. Uh, this is what we're seeing as clinicians, right? I
yeah.
do have just a quick story to tell you
Oh
and the
yeah,
audience
love
that my,
stories.
my granddaughter, she was playing with a classmate. She's in preschool,
Yeah.
and her classmate wasn't feeling well. And then all of a sudden, after a couple of days, my granddaughter, she comes over, spends time with us. And guess what? Now I'm miserable. I'm that person, right?
Yeah.
The nasal congestion, the running nose, the dry cough, the sneezing, the itching, and the fatigue, and
Ah, yeah.
just uneasiness. So yeah, I'm experiencing it.
So yeah, it doesn't seem, we sometimes think, oh, it's going to spare me, and then all of a sudden, out of the blue, we get something, and we often just start thinking, I think my allergies are acting up, just because we know we're in that season right now. So I want to know from your vantage point. I know that we have, as clinicians, have to help patients distinguish what's the difference, really. I mean, what are we talking about here with when it comes to allergies and colds and viruses? Let us see some insight to that, Derek.
Yes, yeah. Great question. I would tell you that on average, what I've known is on average for adults like you and I, we tend to get at least two colds per year. And
Yeah.
if you, the pediatric child setting, it's usually about 2 to 4 colds per year. Actually, 6 to 8 per year, right? Uh,
Right.
there is a difference to their point. The cold is common, it's contagious, it's caused by a number of different viruses. It's over like 200 plus viruses,
Right.
right?
Right.
Including rhinovirus, parainfluenza, SARS, and then when you throw in RSV, the flu, and then you throw on allergies on top of that,
Right.
right?
Right.
So there's a difference. That those allergies is when our immune system reacts to the substances that are in the environment that's usually harmless to most people. But when we come around those pollens, those dust mites, those moles, those cat danders, etc., that's when things start to go awry. Yeah.
Right. I think, back to our title, where we're talking about respiratory inflammation, and all of those things that you just mentioned can cause whether it's just localized to the upper respiratory tract or can move down into our chest. A lot of patients say, I'm afraid it's going to move down, and they can. The inflammation doesn't just necessarily spare one particular area. But that being said, we know that there is, you can have a virus, you can have a cold, you can have allergies, but you can also have both.
Yes.
And we'll talk about that in just a minute. But before we do, what's this triple-demic or some of this conversation about all of these viruses that we've had, but kind of culminating right now? Tell us a little bit about that.
Yeah, interesting, Tara. I have heard of that. And what I've learned is it comprises of something called the RSV, that's respiratory syncytial virus, and influenza, and also COVID-19. With all three of those, and I test, right? When those patients come, I want to know, just like I test allergies, I want to know, right, between those three. So they coexist. And because of there are viruses, right, and I want to know how to go about treating them, they don't need antibiotics. They don't need,
There you go.
we need antivirals, right? Or just let the immune system take care of it itself, especially for those ones who are at moderate severe risk, right? So we want to save those antibiotics for those patients that truly have a bacterial infection,
right,
versus viral. Now, we do know that some of those viral infections can go on to bacterial.
right.
So we want to make
Right.
good testing, good clinical judgment.
Yeah, you bring up a good point there, like kind of like a secondary. So the primary is the virus, a secondary bacterial infection. But really, if that first primary viral infection is just sitting or it comes on when we have this inflammation, maybe this inflammation has been there just kind of underlying just because of allergies.
Yep.
Especially those indoor
Yeah.
allergens, and then we get to this pollen outside, and then we get to viral season. And you bring up a really good point that I kind of want to call out, which is we want to name these, especially in this day and age with COVID. We need to name it. What's going on with me? Because how many times are you sitting next to somebody and you hear them cough or sneeze, and you're like, I want to scooch this way a little bit. So that's also helpful is being able to say, okay, we can do viral tests for some of these, but we need to be testing for allergies too.
Exactly.
Some people just deal with it. Okay, I know every spring, every fall, or wherever their seasons are, but we can be better about that. We can be more precise and know how to try to mitigate some of those allergies. So we're going to talk about that in just a minute when we continue to talk about the inflammation. And I have to bring up this term that actually a coworker shared with me, was just the sneezy, snotty, leaky face. So
Yes.
I think we've all had that, where you're like,
Hey, Tara, say that one more time. One more time. Say that.
okay, this snotty, sneezy, leaky face, or however you want to say it. But I think we can all agree we've felt that before, where we just can't stop our eyes from watering. We can't stop sneezing. The nose, it alternates from congestion to runny, and so you mentioned antibiotics. A lot of patients do come in and say, you know what, I just don't have time for this. Can I have something that stops it? And unfortunately, we don't have that magic pill, and antibiotics aren't that magic pill.
It is not.
They have some. They need to be reserved for those bacterial infections, like you mentioned. Mm-hmm. But again, going back to how do we treat this? I'm gonna, how many of us have stood in that aisle at CVS or Walgreens? It's the plethora of all of these different medications and different combinations, and non-drowsy and drowsy and syrups, and you think, which one's the best? I'll get the one that has it all. Let's just combine it all. And then, but maybe you don't need some of those medications, such as antihistamines, the Benadryls. You may not need that. It may just sedate you when really it's not treating the allergy or the virus, but the allergies may be needed. Anyway, I think that we've all stood in that aisle and thought, I have no idea what this is, but I'm going to try it. And then next time I'll try that. So by the time you get to us, the provider, you want answers.
That's so true.
Am I right? We've got to remember that.
Yes.
So yeah, you briefly, I'm going to have you allude just a little bit more on antibiotics and maybe even some, steroids that sometimes people use or ask for.
Yeah, you're right. And you're right, Tara. I find myself like the average right? Standing in the aisle, looking at all of these options, right? Trying to figure out which one do I take, right? I got this symptom, right? Do I use the deacon? Do I use the anti-cough medicine, right?
Right, right.
Histamines or the like the anti-inflammatories, whatever, right? So you're looking for
You are.
answers to get relief.
Relief.
And to your we do have tests that we can find the answers to, right? Because by the time they get to us, they're at their wits end. They want answers, right? And
Yeah.
so beautiful thing, by the guidelines, we can give them the answers
Isn't that
by
true?
doing
Yeah.
full convenient testing, right, for these patients. And to your point earlier about antibiotics, antibiotics are not the answer, right? They should be reserved for those bacterial infections, for those specific pathogens that can cause that infection, right? And so we always want to keep in mind about something called good antibiotic stewardship, right?
Yeah, that's a good term.
Reserve those medications to be used appropriately for those pathogens that are causing infections. Right.
Those antibiotics are necessary in the right instance. Absolutely. So, we've kind of defined this snotty, sneezy, leaky face.
Yeah.
How can we distinguish maybe just by symptoms alone, or if a patient comes to us, the difference between viruses and allergies?
Yeah, that's a good one. I think we're all faced with that, right? As providers, when those patients come in with what we call those overlapping symptoms, and we
Yeah.
call that the diagnostic dilemma, because we know that there's a term out there, Tara, that some may not be used to, but that's what they call a symptom threshold.
Mm-hmm. Mm-hmm.
Oh, everybody's a little bit different. But what happens is when you have those viruses, right? Those colds or rhinoviruses, right? And you throw on the flu, you throw on allergies, right? The pollens, the dust
Yeah.
mites, it's just wreaking havoc. And once it gets to that level, it gets above that level. That's when those patients begin to start feeling symptoms,
Right.
right? Their immune system becomes taxed, it becomes burdened, or
Right.
it begins to try to combat. Uh,
Exactly. And that's what our nose is doing, is trying to get rid of whatever it's coming in contact with, and so it's inflamed. It's just going to make snot and leaky. And so yeah, you're exactly right. Sometimes we all start out thinking, oh, I don't feel right, maybe it's allergies, maybe it's just allergies, and then a day or so later you're like, oh yeah, there could be a lot more fatigue, maybe a fever, some of those symptoms that can help distinguish, but really they overlap. The symptoms overlap.
yeah,
And like you said, that's when you've exceeded that symptom threshold, and you're miserable. And so you want those answers. So again, we talked earlier about testing. So let's just talk a little bit into the world of allergy testing and the opportunity that we have there to, I like to say, name it. If we say, oh yeah, my allergies are acting up, is it outdoor allergens? Is it indoor allergens? Is it the cat or the dog? Or could it be something else? So let's talk a little bit about that. Dr. Varner, tell me what your perspective is on allergy testing.
yeah. So great question. I would tell you that, Tara, I like what you said about naming it because people are very aware, they're knowledgeable, they're doing research. Dr. Google, Miss Siri, right? And so we do have some FDA approved testing and per evidence-based medicine and guidelines that your healthcare provider, either the allergist or your primary care provider, have at their disposal. Of course, they always want to take a good clinical history, right?
Right.
They want to do an exam. And based upon those symptoms that you're experiencing, there is some approved diagnostic testing to test for those irritants, right? Because we don't know, we're guessing a lot, right?
Yeah.
When it comes to those indoor and outdoor. So there is an approved test for that we can check, is that may be contributing to all of this inflammation, all of that bombardment. So we do
Yeah.
have that.
When you name it, you can say, oh, okay, I don't have to worry about the cat or dog. What I need to worry about are perhaps I need to put a dust mite cover on my bed, or maybe even so much as we say we can't put ourselves in a bubble and go outside. But there are some things that we can do. I challenge all of us to look at pollen.com and put in your zip code. We've been high. So I'm from Arkansas, very high, off the charts. We know that the seasons may last longer even now. And so being able to know, okay, is it high? Maybe I shouldn't open my window on a beautiful spring day. Let those outdoor allergens come inside. Maybe I shouldn't roll down my window driving 60 miles an hour and allow those allergens. But a really good opportunity to say, what are my allergies? You know, what individually do I need to look at and target so that I can reduce that inflammation? Because if we can reduce that inflammation, what do we do with that symptom threshold? We can reduce that down. Yeah, absolutely. And so, yes, I want to take a moment just to say, if there's any questions about this, please put that in the chat. Be happy to address any questions that you have. But again, this testing method, so we have blood allergy testing. Any of your providers can order this test. But I want to ask you, there's also the skin prick testing. Again, specialists can do that. Both important to be able to identify triggers. But how do we have this conversation, if I may? You know, sometimes we don't, we're timid when we come to the provider and say, this is what I want. You
Right.
know, so tell me how that looks like when a patient presents to their provider.
Yeah. So good question, Tara. But before I ask that, but could I ask you this?
Yeah,
Uh, could you share a little bit more about, and I know you're practicing
right.
here and you've seen a lot of patients as well. Could you tell me and tell the audience a little bit more about the value of incorporating that diagnostic testing early in the
Oh, yeah.
patient's journey? And if you have a story to tell, can you kind of share? Uh,
Yeah, you know, sometimes it seems like we test for allergies or maybe we refer our patients to the allergist when things are out of control. After they've been miserable for years or days, or we just can't seem to get it with medicines. And really, what we want to do is calm down that inflammation. So, identification early. So a simple blood test, you can do that. We can find out, is it indoor allergens? Is it outdoor allergens? Really being able to identify that, and then some simple tools that we can search on the internet and say, how do I get my maybe house dust mites? You know, how do I mitigate those or get rid of those?
mhm.
So yes, it does have a lot of value to be able to say, you know what, I identified those. We don't have to keep rechecking them because I know that. And then hopefully we can see some benefit long term when we have reduced our exposure and the inflammation.
Right, right. So what I'm hearing you say with the correct diagnosis by naming it, that means
Yeah,
the patient and your healthcare provider they can create a customized plan to help manage effectively their conditions and their symptoms by a simple or convenient blood test, which is so powerful. It's a good, powerful
yeah,
diagnostic to really identify those things that they may be sensitized and allergic to. Right.
absolutely. Yeah, it's that conversation. You've got to have a conversation with your provider, but you know your provider also wants to get you those answers too. And you know what? Sometimes you might introduce this to them just quickly. I will put on later. Just follow Allergy Insider. But we will put a link to Allergy Insider, and it actually is a website that has a questionnaire. I wonder if I do have allergies. I wonder if I do qualify for maybe having this looked at or tested. And then maybe you can have the conversation by printing that out and just saying, Doc, what do you think about this? Or PA or nurse practitioner or whomever your primary care is. And really any provider can order this test.
That's so true. So true. Gotcha.
It's been a great conversation today. I don't want to take up any more time, but it's been a conversation that needs to be had because we deal with this a lot. And so we want you to continue to go to Allergy Insider for any questions that you might have. Make sure that you have this dialogue with your provider. Do you have any closing comments,
Yeah.
Dr. Varner?
Yeah, thank you so much, Tara. I would just say for those individuals that's in this season and probably all year round, if you find yourself being plagued with that cold, even the allergies, right? Make sure you wash your hands,
Oh,
right?
yeah.
If you
Yeah.
don't have water and soap right away, get some hand sanitizer.
Yeah.
If you have to cough, like when you're in a public setting, you know, cover your mouth, right?
Simple.
Simple, right?
Just make it simple.
If you are sick, not feeling well, please, ladies and gentlemen, boys and girls, please stay at home.
Yeah,
minimize impact so we can prevent the spread. So,
exactly.
so Tara, as we close, when you see patients, can you elaborate? No, no, we'll leave it like that.
Yeah. We could talk for days, couldn't we? Well, it's been an absolute pleasure. Everybody, thank you for joining. Stay well, and don't hesitate to put any comments. We'll continue to monitor the chat here and answer any questions that you have. But Dr. Varner, thank you for your time today.
All right, you're welcome. It's been a pleasure. Thank you so
Yeah,
much.
and stay safe out there.
You too.
All right, take care.
Bye-bye.
Bye-bye.